Good day, ladies and gentlemen. I'm Ramnaresh Dwarika, your host of this series, Addiction and Recovery, which is broadcast every Thursday morning and repeated as well on radio and TV Jagriti at 9 p.m. every night, every Thursday night. This program will be posted on YouTube and Facebook at the end of the program today. And so, those of you who are unable to stay with the program in its entirety, you can go to my channel on YouTube, Addiction and Recovery, Ramnaresh Dwarika, or Facebook, and you will be able to follow the program there. And you can also send a link to anyone you believe who can benefit from this program. Today is going to be a very interesting program because over the years, I have been asked thousands of questions. I've been doing this program on various media houses since 1993 on a weekly basis. And I have been asked um, many, many questions about addiction and recovery. And I have decided to go through these and to sort out at least 12 of what I consider the most important questions. Today, I would like to speak with you about a subject that affects thousands of individuals and families throughout Trinidad and Tobago. And that is, of course, addiction matters relating to addiction and recovery. Addiction does not discriminate. It affects the rich, the poor, the educated, the uneducated, young people, and older adults. It can be found in every community, every ethnic group, every religion, and every profession. It impacts not only the individual, but also parents, spouses, children, workplaces, schools, and entire communities. So over the years, as I was saying earlier on, I've been asked hundreds of questions by persons struggling with addiction, by family members seeking help, and members of the public who simply want to understand this condition better. Today, I will answer what I consider to be the 12 most important questions relating to addiction and recovery in Trinidad and Tobago. My hope is that by the end of this program, you will have a better understanding of addiction, greater compassion for those affected, and renewed hope that recovery is possible. So let's start. Let's jump in immediately. Question number one. What is addiction? Addiction is a chronic condition characterized by compulsive use of a substance or engagement in a behavior despite harmful consequences. So, in fact, the person is aware that it is causing harm but can't seem able to stop it. Now, it may involve alcohol, marijuana, cocaine, crack cocaine, heroin, prescription medications, nicotine, gambling, social media addiction, pornography, or other behaviors that become destructive. And most of these addictions I have spoken about individually, and they are posted on my YouTube channel, so you can go back. Recently, we looked at sexual addiction, we looked at social media addiction, gambling. So the information is there. Addiction affects the brains. It affects the reward system of the brain. So over time, the brain begins to crave the substance or behavior, making it increasingly difficult to stop. So not only substances can cause this craving, even behaviors that promote the release of dopamine in the brain can also cause this addiction. Many people mistakenly believe addiction is simply a lack of willpower. And that's a popular misconception. I see it every day. If that were true, then people would stop after losing their jobs, marriages, health, and finances. I mean, it doesn't take you know, a lot of rocket science to understand that addiction is far more complex. It involves biological, psychological, social, and spiritual factors. All human beings, we are bio, psycho, social, spiritual beings. And whatever affects one part of us has a ripple effect and affects the others. So that this is why our interventions have been failing because medicine concerns itself with mostly the biological side of us. And then, yes, counseling and so on addresses the psychological, psychiatry might attempt to address that, psychotherapy. And then, of course, counseling and the church and all of that will try to address the social and spiritual. But if they're not combined, if the approach is not combined, we are doomed to failure. So, as I said, in Trinidad and Tobago, we continue to see challenges associated with alcohol misuse, marijuana use among young people, cocaine, prescription drug abuse, and increasingly we are seeing behavioral addictions such as gambling, excessive social media use, and so on. The good news is that addiction is treatable and recovery is possible, especially when it seemed to have been gone out of hand. The more desperate the person is, the more ready they are to accept and receive help. So let's jump to question 2. Why do some people become addicted while others do not? Because some people seem to be using drugs and alcohol and all of that for a long time and don't seem to have a problem with it. And this is perhaps one of the most frequently asked questions. The answer lies in a combination of factors. One is genetics. Some people are genetically predisposed to alcohol and drug use and addiction. Then another is family environment. There are some people who live in a family that is very supportive and understanding and can help to prevent the onset of drug addiction, while some other families, the culture is to use drugs and pills and all of that. Then some individuals are exposed to early childhood trauma that can predispose them to addiction. And of course, peer influence. There's some people who grow up, the old saying, show me your friends and I'll tell you who you are. The peer influence, especially in teenage, is very, very profound and effective. Then there are some people with pre-existing mental health conditions that will make them more vulnerable. Of course, availability of drugs is a predominant factor. If you don't have it, you can't use it. And in some communities, it is more readily available in some countries as well because of the laws and the culture. And of course, a person's ability to cope with stress, and to have proper coping skills. It varies from individual to individual. And this is why some people will become more predisposed and vulnerable to addiction. And finally, the social and cultural influences. Like in Trinidad, for instance, it is very popular. Drinking has become woven into the social fabric. Or most people seem to think you can't have a good time. You can't have a party. You can't celebrate anything without a drink, carnival, and all of that. So research suggests that genetics may account for approximately 40 to 60% of an individual's vulnerability to addiction. So that children raised in homes where alcohol and drugs are normalized are at greater risk. Similarly, persons who have experienced abuse, neglect, or significant trauma are more vulnerable to addiction. However, vulnerability does not mean inevitability. Let me say that again. Vulnerability does not necessarily mean inevitably that you are going to become addicted. Many people with multiple risk factors never become addicted, while others with few apparent risk factors develop severe substance use disorders. And this is why it is cunning, baffling, and powerful to understand this. The important lesson is that addiction usually develops over time. It rarely happens overnight. Let us look at question 3. Is addiction a disease or a choice? The honest answer is element that there are elements of both in this. In fact, the initial decision to use alcohol or drugs may involve choice. However, addiction, once addiction develops, the ability to control use becomes significantly impaired. And so that the choice is now influenced by the dependence. Most major medical and public health organizations recognize addiction as a chronic disease affecting brain functioning. And this has been a big debate in the public domain for many years and still continues. That does not mean that individuals are relieved of their responsibility for their actions. Recovery requires accountability. In other words, individuals are not responsible for developing a genetic predisposition. However, although you may be born with that genetic predisposition, once you become aware that alcohol or the drugs is causing problems in your life and you can't seem to do anything about it, then you have a responsibility. Now, yes, a person may not be responsible for the for childhood trauma they suffered. They are not responsible for many of the circumstances that contributed to the addiction. But I'm saying, however, they are responsible for seeking help and participating actively in their recovery. Recovery begins when people stop asking, why me? And beginning asking, what can I do today to get better? So don't see yourself as a victim. You need to take responsibility. As I said, you may not be responsible for what predisposed you, but now that you know you have a problem, it becomes your responsibility to accept it and do something about it. So, question number 4. What are the warning signs of addiction? Early recognition can save lives. Like in most other diseases, if you catch it early, you can prevent 15 to 20 years of hell and misery, if you decide to do something early. Unfortunately, a lot of people in the early stages do not think they have a problem, or if they recognize it, they want to fix it themselves because they do not have the humility to accept help. And so that some of the common warning signs, you know, are increased secrecy, changes in mood or personality. Person is like chalk and cheese. 1 minute they're bubbly and all of that. Next minute they're depressed. Other signs are declining work or school performance. These are observable signs and symptoms. Of course, financial difficulties, especially in the case of cocaine use and some of this, it can use up your finances overnight. Sorry. Neglect of responsibilities is another sign. Changes in sleeping and eating habits. The marijuana user with the munchies in the night, coming out and raiding the fridge. Changes in sleeping and eating habits. Then social withdrawal, starting to isolate, especially when they do not have enough money now to buy for everybody and so on. And the little bit they have, they sit by them, they hide and they use it. And then frequent requests for money, of course, and which leads to stealing eventually. And legal problems, in spite of knowing that Although we have decriminalized marijuana in Trinidad, it is not legal. A lot of people are confused over that. And I've spoken about this in the past. You know, then there is also the attendant other criminal activity to support the habit. Prostitution, stealing, fraud, and all of that. Borrowing and can't pay back. So a lot of legal problems, loss of interest in hobbies. A person who was interested in cricket and tennis and all of that is now no longer interested in those things. And of course, as we head to the chronic addiction, you start seeing a deteriorating physical appearance. Person looking unkempt, not bathing, not changing their clothes. And of course, that's when you start to look like the vagrant. And of course, relationship conflicts, quarrel in the home, you know, because this person can't, especially if the person is the head of the household, is going to lead to a lot of family conflicts. Family members often tell me that I knew something was wrong, but I kept hoping it would go away. Because family, even though when they suspect, they try to keep it a secret, they try to fix it in house because it's so stigmatized, addiction. The earlier the treatment begins, the better the outcome. Because a lot of people eventually, when they lose their job, they lose their family, lose their health, and all of that. Now they're using it to cope, to medicate, to deal with depression and anxiety. And at that stage, it becomes more difficult to stop. So let's quickly look at, I know the clock is running down. Question number 5. Why do addicted persons continue using despite serious consequences? And this is something that perplexes a lot of family members and even professionals. Many families ask, why doesn't he stop? Doesn't she realize what she's doing to the family? Or some may say he has lost his mind. Yeah, he's gone crazy. The answer is that addiction changes the way the brain processes pleasure, motivation, and decision making. So it's no longer just an intellectual thing. Has become an emotional illness, a spiritual illness, a physical illness, a social illness as well. So that eventually individuals are no longer using simply to feel good. They may be using it now to avoid withdrawal symptoms because when you've been using for a long time and you stop, it could become very painful. The withdrawal symptoms, vomiting, uh, nausea, insomnia, irritability, depression, panic attacks, all of those are included in the withdrawal symptoms. They may also be using it to escape emotional pain that their own drug use might have caused because of they gamble out the money and all of that. They owe in so many people and they promise the family this and that and can't deliver. And of course, sometimes they use it to reduce anxiety or depression and may switch between illicit substances now to licit substances or vice versa. They may switch from prescription pills to illegal drugs to help them because they're developing tolerance. And some people, of course, because of the consequences of the drug addiction, divorce and separation and all of that, they now have to cope with loneliness, loss of the job and all of that. And they continue. This is what perpetuates their drug use. And of course, some of them, they feel temporarily normal, but then as soon as it starts to wear off, they go back to craving the drug. So that addiction becomes a vicious cycle. You using it to help you to deal with the withdrawal symptoms, only to go back into withdrawal as soon as the drug effects wear off. So that the person may be desperately wanting to stop while simultaneously feeling unable to do so. So I have heard among the people in recovery, live in to drink and drink in to live, that vicious cycle. Live in to drink or drinking to live and then living to drink? Let us look at question number 6. Can a person recover without professional help? And a lot of people would like that. Not only professional, they don't want to go to AA, they don't want to go to anyone, counseling or anything like that. Now, the truth is, some people can and do recover without formal treatment. And I've heard a few people brag, look, you know, or will come with a son who is addicted and say, look, I used to drink, or the wife will say, he used to drink, but look, he never went to AA, he never went to Cora or anywhere. And look, he stopped. Yes, some people do when faced with some very traumatic incident, charged by the police or separation, divorce, things like that. Or the doctor say, look, you're going to die. Your liver is now, suffering with fatty liver and cirrhosis and all of that. So some people take it seriously and that starts them off to recovery. But others, and most of the time, those people who have been using for a long time, when they stop, they need to be detoxified. And they need to be detoxified under supervision because sometimes withdrawal could be very scary. Some people could hallucinate and panic and do harm to themselves. And some people need residential rehabilitation because the community in which they live actually living on a drug block, or the other people in the house are using. And so in that milieu, they are not able to stop. And of course, this is not a problem that you could fix with a pill or an injection. And this is why I've been failing. Some people think that, you could go to the doctor and get some tablet to make you feel better. But yes, you will be relieved from the alcohol um, withdrawal symptoms temporarily, only to get hooked on the prescription pills now, which the withdrawal symptoms is even worse. And you may not be able to come off for the rest of your life, you're told. And then, of course, there's the need for psychiatric services because some people need to be managed with medication initially. And of course, medication assisted treatment is very, very useful. I worked at Cora, St. Anne's, so some more one in San Fernando, I can tell you. Now, I have also found that though some people might make it on their own after detoxification and initial rehabilitation and so on, counseling, but a lot of them relapse if they don't find a support group in their community because the support groups provide long-term aftercare for free. Alcoholics Anonymous, Narcotics Anonymous, and all of that. So that recovery is not a one size fits all. It's not that. If a person has tried repeatedly to stop and has failed, professional help should be sought. There is no shame in asking for assistance. We do not criticize people for seeking treatment for diabetes or hypertension or heart disease. Addiction should not be any different. Seeking help is not a sign of weakness. It is a sign of courage. So, question number 7. What is the best treatment for addiction? Some people having, they out of what you have the pre-contemplative stage, the contemplative stage, now they'll be asking, what is the best rehabilitation center? What is the best program? What is the best approach? I have been asked these questions. And I want to present without bias. I don't hold any brief for any treatment facility in Trinidad and Tobago. The truth is that there is no single treatment that works for everyone. Some people may do very well after a short 6-week program. Some people need a 3-month program as is offered at New Life Ministries. Some may need, like in the old days, having to go to Pipara for 9 months. The length of the program, to my mind, has not really determined the success. What really determines the success is the person's uh, level of insight and motivation for recovery. That is critical. And of course, the quality of care whether it's short-term individual therapy or long-term. So effective treatment typically includes a comprehensive assessment. You need to know what you're dealing with. What exactly is this person who is sitting in front of you? What are their issues? Not what you may think their issues are from your experience in the past with other people. Each person is unique and, and peculiar in their own way. So that effective treatment should also include individual counseling because there are some issues that a lot of people are unwilling to speak about or divulge in a group setting or in other settings. So they need to have a one-on-one with a counselor who is experienced in this field. And of course, group therapy has been found to be very effective because one person telling you this does not carry the effect of hearing it from a lot of other people, your peers, people who have been through the same experiences. And of course, relapse prevention is critical. Having gone through treatment and all of that, you need to also come out learning life skills, proper coping mechanisms, so that drinking is only a symptom or drug using is only a symptom. The person still has to deal with all the other underlying factors that would have precipitated and perpetuating their drinking. Then, of course, nutritional support. The active user very often neglect their personal health and they become malnourished and all of that. And a strong mind in a weak body doesn't really cut it. Exercise is also very important to stimulate the body now to quickly recover. And then finally, the spiritual development. Every Most people in Trinidad and Tobago, I know, believe in a higher power of some sort, whether you be Hindu, Muslim, Christian, or whatever. Even atheists believe that a group can help them because everything they tried within themselves have failed. So now they have to turn to something else. And of course, continued follow-up care. A lot of people are highly motivated when they leave the centers, the rehab centers, and all of that, but they fall because they do not have follow-up. So that the most successful programs addresses the physical, the emotional, social, and spiritual dimensions of recovery. Treatment should not end when a person leaves a rehabilitation center. Recovery is a lifelong journey because some of those symptoms that predisposed you to alcoholism, the genetic factors will always be there. Let us look at question 8. What should family members do? Families play a critical role in recovery. When I say me is not just this body sitting in this chair. Me extends to everything I call mine. My family, my brother, my sister, my children, even my pets and my car and all of that, house, all of that is part of me, what I identify as me. And if any one of those things are affected, then me, by extension, is affected as well. So sometimes, you know, families can bring so much pressure on one member of that family to to perpetuate the drug use or predispose them to drug use. And so too, just like friends, the family can help you to recover as well. So here are some of the recommendations for the family members. You need to educate yourself about addiction. And when this program started, some 30 something, 33 years ago, that was one of the main planks, the motivating factor to educate our brothers and sisters here in Trinidad and Tobago about the nature of this illness. Because in my experience and working in the field there, I found there's so much misconceptions, you know, among family members and members of the public in terms of addiction and recovery. family members also need to encourage treatment. Now, as I said before, family members would like to keep this because of the stigma, keep this the problem with their sibling or relative a secret because you live in communities and nobody likes their neighbors and so on to know that look, we I have a daughter who is now addicted to alcohol. No, 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 no. And even though the person comes out of treatment, sometimes we don't encourage them to go to meetings because that will cause people to know, for the rest of they have to go to meetings in the community or now, thank God, we have meetings online as well. But you need to encourage the person to seek help, one, and when they come out of treatment to also continue with their treatment. Now, family members need to set healthy boundaries because in the process of addiction, because let's take the wife is a the husband is addicted to the alcohol, but the wife is addicted to him because she's in love with him or dependent on him as well, just like he's dependent on the alcohol. And as a result of the stigma, they cover up for him. Now he's sought treatment and come back, but he is expecting that they roll out the red carpet for him because he's making this supreme sacrifice. He has given up drinking and all those other things, and he's doing this for the family and all of that, so that they should treat him with kid gloves now and every day. And yeah, they'll do that maybe for a few days in the beginning, but after a while, so what? It's stale news now that you stop drinking, so what? You need to get on with life now. And so family members need to set healthy boundaries before the person seeks help. That is what will get them to seek help in the first place. It's called tough love. And even after they come out of treatment or they stop, you still need to maintain healthy boundaries, you know? So avoid enabling behaviors. Help the person or remind them to start. You need to get ready and go to your meeting. You need to pay your debts. You need to now pick up after yourself. You need to clean up the room after. You need to start picking up your responsibilities. Mothers and sons, they're so happy he has stopped drinking. Now, anything he wants, give it to him, man. We're rewarding him. We wanted the motor car. We buy a car for him, and you know what? Go and get drunk and mash up the car. They need to attend support groups. That is what will sustain them in the long run. Practice self-care. Family members also need to realize that they too need the help, and not only him going or her going to the AA or NA group. There's the Al-Anon group that family members need to also attend to realize how they have changed because of their family members' addiction. They need to start taking care of themselves. I've seen a mother recently, completely neglecting herself because of her son's addiction, and of course, maintain hope. So that they need to avoid giving money that may be used for drugs, especially in the initial stage. Because when a drug addict gets money, it could induce the craving. They need to stop making excuses for the person's behavior. They have to start taking responsibility. They need to start covering up legal or financial problems. And finally, they need to accept, they need to refuse to accept abuse or violence from the person while they're using drugs or even after they stop using drugs. Family members often become emotionally exhausted. So I want family members to remember this. You cannot force someone to recover, but you can create an environment that supports recovery. Question number 9. What is relapse and can it be prevented? Relapse is a return to substance use after a period of abstinence. So sometimes people have a slip, what is called a slip. Okay, you're alcoholic and you went to a relative and they gave you a piece of cake and you didn't realize that it had alcohol in it. You know, the black cake that we are famous for making in Trinidad. And so you eat a piece and realize it had alcohol. That doesn't mean to say now you have to continue to eat it or drink alcohol because of that. You had a slip, right? Or you took a medication and then realized after when you started to feel dizzy, oh wait, it had alcohol in that cough syrup, you know? Now, the better thing is prevention. You need to be mindful of these things beforehand. But even if it happens, you don't fall down and stay down. So that a relapse should not be viewed as a failure because for some people, relapse becomes part of recovery. Many individuals experience one or more relapses before achieving long-term recovery. So that relapse often begins long before the person takes the first drink or drug. Usually in recovery circles, they say when the stinking thinking starts coming back. When you're sitting down there and you're going over, boy, we had a good time that time when we went there and we drank so much and we did this and we did that. And you start glorifying those experiences, you know, you start missing it. You start wishing in your mind, boy, I wish I could go back and do that. And nobody knows. Your family members are unaware what's going on in your head. But you know, once you start thinking of, if I take one, nobody will know. I look, I'm so long sober, I could probably, and sometimes even family members tell you, look how long you stopped drinking. You're very disciplined. And they inflate your ego to the extent where you think, I could take one. And now I know what to do. I'll just take one and I will stop or two. And I have seen that playbook so many times, repeating itself. So that relapse often begins long before, as I said, the first drink or drug. And common warning signs include isolation. Person starting to isolate. They don't want to go to the meeting, they by themselves, they lock up themselves in the room for long hours and all of that. And then, of course, stress, being stressed out all the time. Or, on the other hand, overconfidence, going and liming with the same friends again in the shop, going to the beach lime and all of that, you know, ch- taking a little chook in the gamble and all of that, or the playway and all of that. So then the obvious signs is poor self-care, like going back to not bathing and trimming and, that kind of thing. The old image, returning to unhealthy environments, as I mentioned, associating with former using friends, failure to attend support meetings, unresolved emotional issues, you know, picking rows unnecessarily, becoming irritable. And so that recovery requires vigilance. On especially your recovery depends on you. Nobody can't do it for you. You have to always be on your P's and Q's. So some people spend years preparing for a career, but only minutes before preparing for their recovery. Let me repeat that. Some people spend years preparing for a career. You go to school, you do your subject, write your exams and all of that. So eventually you'll get a job. Recovery is similar. You need to prepare for recovery. You have to sustain the effort. So that relapse prevention should be a daily practice. You need to examine the thoughts as soon as they come in the mind. Let us quickly look at question number 10. How long does recovery take? Another common question is, when will I be cured? Well, this one, unfortunately, like diabetes, well, now they're finding cure for even diabetes and hypertension. I've been working with patients now to help them to use diet because hypertension and diabetes is not caused by a bacteria or virus. And although it might be genetic and everything, similar to drug addiction, if you the same way same program, one day at a time, you can be in remission from your diabetes and your hypertension. Maybe I'll speak about that another time. So some improvements happen quickly, like you're able to sleep better, improve appetite, increase energy levels, better relationships. But other changes may take months or years. Trust, for instance, must be rebuilt. That takes time because after all the lies you've told, the amount of times you stop and you went back and drink, people do not have they don't trust you. Then emotional healing takes time. The insults and the abuses you gave people, the physical violence, that they don't forget it overnight. And then, of course, spiritual growth takes time as well because you have not built that relationship with your higher power over the years. So that recovery is not an event, it is a process. And just putting down the glass there would lead to abstinence, but not necessarily sobriety. The goal should not simply be to stop using substances. The goal should be to build a meaningful, productive, and fulfilling life. So that let us look at question number 11. What role does faith, spirituality, and the 12 steps play? For many individuals, spirituality becomes a cornerstone of recovery. So if you ever went to an AA meeting or any meeting, you'd hear almost every person who goes up there to give a contribution, a talk, speaking about their experience, strength, and hope with the drug experience when they were using, the strength they have found since they have stopped in the fellowship and so on, and their hope, their plans for the future. You'd hear them say, it is all but for the grace of God. Because my own personal view is that, yes, I tried everything I knew before to stop, every formula I knew. And I mean, I was a social worker even then. I thought I knew a lot. I could help people with a lot of problems. But try as I might, it was only until I went and prayed and I'm a Hindu, I threw my gel and asked God to help me to stop just for today. That was the 11th of December, 1983. And today I firmly believe, I've come to know that only God could remove that obsession to drink. So that for many individuals, as I said, spirituality is very important. The 12 Steps of Alcoholics Anonymous and other fellowship programs have helped millions of people worldwide to stop using drugs. And now it is not only in Alcoholics Anonymous, you have Narcotics Anonymous, Gamblers Anonymous, Overeaters Anonymous. I spoke about Sex and Love Addicts Anonymous. So the 12 steps encourage individuals to admit they have a problem. Now, not only alcoholism and drug addiction, even in social work, in my profession, I know that a problem is only one of definition. And you can do what you want. If the person don't believe they have a problem, they don't think they need help. So first thing they have to admit that they have a problem. And of course, they have to have the humility now to seek help and to accept help as well. They of course have to take personal responsibility for the problem. The problem is not mine, the counselor, or the social worker, or anybody else. It is your problem, and you have to want to fix it. They also have to become willing to make amends. So that I have, if you go to my channel, you will see I've discussed the 12 steps in detail in previous programs. You can type it in 12-step program and you will see it there. And becoming involved in helping others take away your mind from your own problems and all of that. You know, there's a saying in AA, for instance, that whenever everything else failed to keep an alcoholic sober, intensive work with other alcoholics never fail. I have found that as a social worker as well, in trying to help other people, I learn so much more about myself as well. And of course, pursuing spiritual growth. A lot of people coming out of rehab, it is suggested, I have suggested to them as well, to go back to your temple, your mosque, your church, And there's a treasure trove of spiritual guidance there. People with mentors, gurus with experience, pastors, priests, imams, who can help you with other of life problems as well that you're definitely going to have when you stop using and drinking. So it means developing a sense of purpose, meaning, and connection. People in recovery often tell me, I stopped surviving and I started living. Faith, hope, and service to others can become powerful tools in maintaining long term recovery. So let us look at again the last question here, question number 12. Where can people in Trinidad and Tobago find help? If you or someone you know is struggling with addiction, please remember that help is available. We are so fortunate in Trinidad and Tobago that we have, you know, the highest proliferation of AA groups per capita than any other country in the world. Just before the COVID, the last time we checked, there was almost 120 something AA groups in my community alone in Felicity where I live. We have 5 AA groups on a Wednesday night, Friday night, Saturday night, Sunday night, Monday night as well. There are meetings, AA meetings. And then there are several NA meetings in close proximity in Chaguanas, Hoover, San Fernando, as far as I am aware. So that there's no other country in the world that has so many. I studied in Jamaica, and at that time there were just 5 groups in the whole of Jamaica. So that we also have support available through public health services in every one of our health centers. There are mental health officers, there are psychiatric social workers, psychiatrists, medical professionals who are well trained and prepared to deal with addiction issues. And then there are private counselors and psychologists. Like myself, I have a private practice. Yes, I see patients by appointment, and the number is on the screen. Then there are rehabilitation centers. We have both public and private. You have the Substance Abuse Prevention and Treatment Center at Cora. There used to be the Piparo Empowerment Center. Then there's Rebirth House, there's New Life Ministries, there's Heal House. There are so many of these other non-governmental organizations. And as I mentioned, Alcoholics Anonymous, Narcotics Anonymous. We also have faith-based organizations and community support programs that can are very useful. Then, of course, mental health professionals. So do not wait until the situation becomes a crisis. The earlier the intervention occurs, the greater the likelihood of a successful recovery. Most importantly, never give up on yourself or someone you love. You need to remember, and that's the purpose of these programs, to help you to understand that, look, alcoholism and addiction is not a bad habit. It might have started as that, but it becomes, for those, some people do not become addicted. But, you know, not everybody, as I've said, not everybody who drink will become alcoholic. But everybody who became alcoholic started with that first drink. So that those of you who are using, you are heading down a path that can possibly lead you to addiction and problems. So that I want you to know, if you stop early, you can prevent yourself, save yourself 20 or 30 years of literal hell and misery. And of course, a lot of people are ended up in prison. You know, there are only 4 places addiction can take you. Actually, prison, mental hospitals, cemetery. Actually, there are three, generally 3 places: prison, mental health hospital, or cemetery. And nobody really is rushing to get to any of those places. So, as I conclude the program today, I want to say briefly, I want us to reflect briefly on the 12 questions we have discussed. And of course, if you want to, you know, I just quickly recap them. Today in this program, we have learned what addiction is, why some people become addicted and why others don't, whether addiction is a disease or a choice, how to recognize the warning signs, why do people continue using despite the consequences, the role of treatment, the importance of family support, the realities of relapse, the lifelong nature of recovery, the role of spirituality, and where to find help in Trinidad and Tobago. Of course, my number's on the screen. Anyone has any questions, you can call the numbers. You can text me at 768-5925 for if you have further questions and so on. So if there's one message I would like you to remember today, it is this. Addiction is powerful, but recovery is possible. Every day, people who once believed they would never recover are rebuilding their lives. Families are being reunited. Children are seeing their parents sober. Communities are becoming stronger. So no matter how hopeless the situation may seem, there is always hope. If you are struggling, reach out. If you know someone who is struggling, encourage them to seek help. And if you are in recovery today, continue taking one day at a time. So I want to thank you all for joining me for this discussion on the 12 most important questions and answers relating to addiction and recovery in Trinidad and Tobago. May we continue to work together to build healthier individuals, stronger families, and a safer and more compassionate nation. I want to thank you. I want to thank the radio and television station. I want to thank the staff there, Jason Kalu in particular, for organizing these programs every week, scheduling them, Mr. Bimal in the operating studio, Mr. Vijay Maharaj in particular, who continues to give a free airtime as a community service on this radio and television station. And to remind you that this program is going to be repeated at 9 p.m. tonight for those of you who missed it earlier, who couldn't stay for the whole thing. And it is going to be posted on YouTube and Facebook in a few minutes. So that I want to thank you all again for joining me today. And until next week, Thursday, may God bless you and keep those of you in recovery sober until another day. Thank you all very much.